Dr. Winston Carhee here, owner part of South Pain and Wellness Center located in Southwest Atlanta, city of South Fulton. We're talking today about the global pandemic, COVID-19, and all the stress it's causing and how you can cope with the stress. It's amazing. It is overwhelming, but we have to get through this. This too shall pass. But how do we get through this? All right, talking about stress and coping. All right, so first and foremost, the Centers of Disease Control, this is all coming from the website, right? They have a disaster distress helpline, 1-800-985-5990, 1-800-985-5990. Also contact the National Domestic Violence Hotline. Unfortunately, you're in close confines with those you know, like, and love. Sometimes it can rub the wrong way. People do things they shouldn't. But let's call the Domestic Violence Hotline if you need it. 1-800-799-7233. 1-800-799-7233. All right, the outbreak of coronavirus disease in 2019 or COVID-19 may be stressful to many people. That's an understatement. But fear, anxiety about disease can be overwhelming and cause strong emotions in adults and children. Coping with stress will make you, the people you care about, and the community stronger. So we're helping empower our community. Everyone reacts differently to stress in different situations, but you have the power to react. Remember that. All right, you respond to the outbreak, and your response can depend on your background and the things that make you different from other people and the community you live. All right, we have a strong community, so we should be strong as well. But people who may respond more strongly to the stress of a crisis include older people, people with chronic diseases who are at higher risk of COVID-19, children and teens, people who are helping respond to COVID-19, like doctors, other healthcare providers, and first responders. God bless you all. All right? They're under more stress than others. People who have mental health conditions, including problems with substance abuse. Unfortunately, that's high in our community, so we have to watch out for that, okay? If you or someone you care about are feeling overwhelmed with emotion like sadness, depression, anxiety, all right, or feeling like you want to harm yourself or others, please call 911. You can also call the Substance Abuse and Mental Health Services Administration and Disaster Distress Helpline, 1-800-985-5990. All right, or talk to us. All right, they have a text, 66746. All right. Stress during an infectious disease outbreak can include fear and worry about your own health, the health of your loved ones, those you know, like, or love. Changes in your sleep and your eating pattern may occur. Difficulty sleeping or concentrating may be a problem. Worsening of chronic health problems often arise during outbreaks. Unfortunately, increased use of alcohol, tobacco, and or other recreational drugs. People with pre-existing mental health conditions should continue with their treatment and be aware of new or worsening symptoms. Additional information can be found at the Substance Abuse Mental Health Service Administration, their website. Take care of yourself, or your friends or your families can help you cope with stress. Helping others cope with stress in this stressful time can also make your community stronger. That's what we're attempting to do. We're talking about stress, and now we're talking about the things you can do, right, to help yourself cope during stress, during these stressful times. Number one, you have to take breaks from watching, reading, or listening to news stories, including social media. Unplug, please. Hearing about pandemics repeatedly can cause more stress and be very upsetting. You have to take care of your body, all right? Take deep breaths with your diaphragm. Stretch. Meditate. Try to eat healthy. Eat well-balanced meals. Exercise regularly. Get plenty of sleep and avoid alcohol and or drugs. All drugs. Make time to unwind, decompress, relax. Try to do some other activities that you enjoy. Connect with others. Talk with people you trust about your concerns and how you are feeling. Call your healthcare provider if stress gets in the way of you or your daily activities for several days in a row. Do not, if you're aware of this, you please call the healthcare provider as soon as possible. Now, how can we reduce stress in yourselves and others, right? You can share the facts about COVID-19 and understand, all right, the actual risk, all right, to you, yourself, and other people that you care about, and how you can make this outbreak less stressful. Knowledge is power. So get more knowledge about the situation. When you share accurate information about COVID-19, you can help make people feel less stressed and allow you to connect with them. So please use official, like I'm using this, the CDC website, cdc.gov. Learn more about taking care of your emotional health. Knowledge is power. Now, what about parents? Parents with children, we know that can be stressful, all right? Or teens, what are you going to do? All right, how do you react? In part of what they see from an adult around them, that's how they're going to respond. When parents or caregivers deal with COVID-19 calmly, confidently, they can provide the best support for their children. Parents can be more reassuring to others around them, especially their children, if they are better prepared, okay? Now, not all children and teens respond to stress in the same way. Some common changes to watch for include excessive crying or irritation in younger children, return to behaviors they have outgrown, for example, toileting accidents or bedwetting, excessive worry or sadness, unhealthy eating or sleeping habits, irritability, acting out behaviors in teens, poor school performances, or avoiding school altogether. Even though it's remote, they should be doing regular school activities. Difficulty with attention or concentration, help them focus. Avoidance of activities involved in the past. So things they used to like to do, they're now not doing anymore. It's a clue. Unexplained headaches or body pain. All right? This is where we come in, okay? Use of alcohol, tobacco, or other drugs. Be aware of that in your children and teens. There are many things you can do to support your child. Take time to talk with your child or teen about COVID-19 outbreaks. Answer questions and share facts about COVID-19 in a way that your child or teen can understand. Reassure your child or teen that they are safe. Let them know it is okay to feel upset. Share with them how you deal with your own stress so that they can learn how to cope from you. Limit your family's exposure to news coverage of events, including social media. They shouldn't be exposed to this all the time. Children may misinterpret what they hear and can be frightened about something they do not understand. Try to keep up with regular routines. If schools are closed, create schedules for learning activities and relaxing or fun activities. Be a role model. Take breaks. Get plenty of sleep, exercise, and eat well. Connect with your friends and family members. Let's learn more about helping children cope for responses. All right. For responders, okay? People who are responding to COVID-19, God bless you. COVID-19 can take an emotional toll out on you. There are things you can do to reduce secondary traumatic stress reactions. Secondary traumatic stress reactions. Acknowledge that secondary traumatic stress reactions are real and can impact anyone helping families after a traumatic event. Learn the symptoms, including physical, fatigue or illness, and mental, fear, withdrawal, or guilt. Be aware of these. Allow time for you and your family to recover from responding to a pandemic. Create a menu of personal self-care activities that you enjoy, such as spending time with your friends and family, exercising, or reading a book. Take a break from media coverage of COVID-19 and social media, all news, etc. Ask for help if you feel overwhelmed or concerned that COVID-19 is affecting your ability to care for your family and patients as you did before the outbreak. Learn more about tips for taking care of yourself during emergency response. For people who have been released from quarantine, being separated from others or healthcare providers, you think that you may have been exposed to COVID-19. It can be very, very stressful. Even if you do not get sick, everyone feels differently after coming out of quarantine. Some feelings may include, but are not limited to, mixed emotions, including relief after quarantine, fear and worry about your own health and the health of your loved ones, stress from the experience or monitoring yourself or being monitored by others for signs and symptoms of COVID-19, sadness, anger, frustration because friends or loved ones have unfounded fears of contracting disease from contact with you, even though you have been determined not to be contagious. Guilt about not being able to perform normal work or parenting duties during your quarantine. Other emotional and mental health challenges may arise after you're released from quarantine. Children may also feel upset or have other strong emotions if they or someone they know has been released from quarantine. Hopefully, this information has been helpful. We hope and pray that none of your friends, family, or loved ones are affected with this COVID-19 virus, but we understand this is highly contagious and we truly hope this has helped our communities. If you want more information about these public service announcements, please go to cdc.gov for more information. Thank you and God bless.